Hi, happy morning everyone. Welcome to Metier YouTube channel. I hope you're all fine and preparing well for upcoming NORCET AIIMS exam as well as RRB exams. RRB exams, the date was not announced, but we are expecting more before April 2025. But in AIIMS NORCET, they have announced the date, that is April 12. So in our Metier Academy, we have started a new batch for specifically for the NORCET, that is batch V14. The classes started yesterday, today onwards. Okay, yesterday we had a demo session also. Okay, you all want to join, please kindly utilize this opportunity. So last date to enroll for these classes, it is Jan 10. Okay, so we are posting updates and the questions in our Meteor YouTube channel. So kindly subscribe our channel so that you will get a notification as soon as possible. Okay, we'll start today's session with a small quote. Motivation is what gets you started. Habit is what keeps you going. So motivation வந்து உங்களோட தொடக்கத்துக்கு உங்களை ஒரு உந்துதலாக தான் இருக்கும். பட் ஹேபிட் தட் மீன்ஸ் நீங்க பழகிறது டெய்லியும் படிக்கிறது தான் உங்களை வந்து அடுத்த ப்ரோக்ரஸுக்கு கொண்டு போகும். ஸோ மோட்டிவேஷன் ஜஸ்ட் ஃபார் த யுவர் starting, that is just like a key, but your continuity, your habit is what will make you success. Okay, so please make a habit of study daily, so that will be helpful for any nursing competitive exams. Okay, we'll start today's session. Today we are going to see about the image based questions. Okay, because in NORCET we will have the image based questions, so today we have prepared for the image based questions. Ready? Yes. First question. The procedure shown is associated with which disease? So they have given this picture. So what they are doing? They are removing some parasite, right? They are removing a parasite. Can you see it here? This is a parasite. So which is related to which disease? So the options: dragonculiasis, lymphatic filariasis, Madura foot, onchocerciasis. So the correct option is dragonculiasis. Okay, the correct answer is, one second. The correct answer is dragonculiasis. What is dragonculiasis? It's nothing but it is an guinea worm infestation. When the person drinking the contaminated water which is present with the larva, okay, that is mainly the guinea worm, what will happen? It will penetrate our stomach and it will grow in our stomach. Okay, the worm infestation will be present in the stomach. Then what happen? The female worm which is present in our stomach get migrated to the surface. I'll show the indicator so that it will be easy for you to understand. Okay, so see, first here, human drinks the unfiltered water which is present with the larva, that is mainly guinea worm. Usually these worms are ingested by the fish, frogs and other aquatic animals in the water. Usually it will be eaten by the frogs and everything. When the human drinking this contaminated water or uncooked fish, so what will happen? This larva will enter into our digestive system. So, okay, then what happened? That larva, mainly the female larva, will migrate from the digestive system to the periphery, mainly to our foot. So that is why in this image you can see this is the female larva. Okay. So what is happening here? The physician is trying to remove the larva which is present in the periphery. Okay. So if you are not removing this larva, what will happen? Again, if you are keeping your foot in the water, this female larva will be enter into the water system. Again, it will get multiply. This is the cycle of this guinea worm infestation. It is called a dragonculiasis. Okay. So what is lymphatic filariasis? So this is the symbol of the lymphatic filariasis, right? Elephantiasis, whales call, no, Yanikal. Yes. What is this Madura foot? What is this Madura foot? It's nothing but it's a slow spreading skin infection. A small, hot, painless nodules will be there. Ulceration and pus discharge will be there. Discolorization, itching will be there. Why it is called Madura foot? You know, It is in early 1880s and all. This infection was detected in a district of Madurai, Tamil Nadu. So that is it's called Madura foot. Okay. And we have seen the option called onchocerciasis, right? That is river blindness. When the parasite infection which is affecting the eye, okay, when the person is taking the bath in the contaminated river which is present with more parasite, it can lead to the blindness. That is called onchocerciasis. That is river blindness. Clear? So according to this image-based question, the answer is A. Clear? I hope you understand. So if you have any doubts, you can message in the comment box. Okay. Okay. Next question. This image is indicative of which disease? So you can see the image. They have mentioned the cupping, splaying, fraying. Okay. Cupping, splaying, and spraying. So all this which present in which disease? Options: osteomalacia, rickets, scurvy, skeletal fluorosis. So the correct answer is what? Yes, it is rickets. So the cupping, splaying, fraying, all will present this indicative of rickets. So nothing but when you take a child hand X-ray. So usually when the child is expecting of nutritional rickets or any type of rickets, they will take a image of the child arm. So they can see the long bones growth, how the long bones are getting growth. So then they will diagnose whether it is a rickets or not. So what is that? What is meant by fraying, splaying and all? I'll show the picture. Yes. What is fraying? Fraying means nothing but indistinct margins of the metaphysis. So consider this is as a long bone. Okay, this is a long bone. Can you see it here, the black color marks? That is indicating a metaphysis are not having the proper margin. That is called fraying. Okay, just like a frying pan, right? That is fraying. Next is what is playing? Splaying. Widening of the metaphyseal ends. Can you see? So U types, that is called splaying, the widening of the metaphyseal ends. Next is cupping. Nothing, cupping means it become like a cup, concavity of the metaphysis. That is called cupping. So these three, fraying, splaying, cupping, are seen in the rickets. Okay, that is the correct answer. Okay, next. In which of the following condition is this sign seen? Can you see it here? So what is this? Onchocerciasis, ophthalmic neonatal, trachoma, vitamin A deficiency. What is the correct option? The correct option is yes, it is vitamin A deficiency. So what is this? It is bidot spot. Am I right? Yes, it is bidot spot seen in the vitamin A deficiency. So why it is happening? Why it is happening bidot spot? Bidot spot is nothing but it is a keratin which is normally will present in our superficial layer of the conjunctiva. When the vitamin A deficiency occur, it become irregular in shape and visibly we can see this bidot spot. It is related to the vitamin A deficiency, right? Yes. Next question. So this is the logo of what? Baby food, FSSAI certified food, organic food, vegetarian food. So what is this symbol indicating? C is right. Many of you know that. Yes, it is organic food. Okay, it is organic food. So what is the symbol of baby food? So this is a symbol of baby food. One bowl with food and spoon. This is indicating of baby food. Many baby food containers, you can see this symbol. What is FSSAI symbol? So what is the abbreviation of FSSAI? Food Standard Safety Authority of India. That is FSSAI. This is a symbol of that. Okay. This is a symbol of vegetarian food. A green triangular with a green circle. Clear? Yes. So this is a logo of organic food. So last question today's identify the instrument. Many of the NORCET exams, definitely there will be one instrument will be there. Okay. So what is this instrument? Options: tissue holder, skin retractor, fascia cutter, stapler remover. So correct option is it is stapler remover. Don't think that as a that stationary stapler remover. Okay, stapler is a surgical stapler remover. Sometimes in the exam, they won't give us a surgical stapler remover. Sometimes they will use a stapler remover. So this is stapler. This is a disposable stapler. This is a plastic one. I'll show the pointer so it'll be easy. Okay. So this is the stapler, which is, can you see it here? So in place of sutures, they'll use the staplers. Okay. Nowadays they are using gums also. Okay. So this is a disposable stapler remover. So this is the metallic one. Okay. So so in the skin, it will be like this. After cutting, it will come like this. That is why it's before and after. Okay. So this is stapler remover. Okay, that's all about today's class. Thank you so much. I hope you understand that and the class was helpful for you. If you like the class, please press the like button. And if you have any doubts, please type it in the comment section. Thank you all. Thank you so much. See you in the next class.